Welcome to Raaonline. I am Dr. Gowri Shanker. I am based at Chennai. I have done my postgraduate diploma in Diabetology 17 years back and I have been teaching Diabetology since then. I am a regular contributor to various national forums like Diabetes India, RSSDI, and also I have been invited for various regional conferences. Year on year I am doing this, and also I have given talks in various medical colleges teaching young undergraduates and postgraduates on various specialties of diabetes. I would like to dedicate at this juncture the entire course to my teacher, Professor Venkatraman, who have mentored me on this. This master class in diabetes is based on resources which I would like to quote. One is International Textbook of Diabetes, 4th edition, which is an extremely useful resource. The second I would like to recommend is the Standard of Care, which gets published every year in the journal Diabetes Care. So this journal releases every year the new updates are updated in this Standard of Care, which is available for free download, and any doubts that comes, any recent things that we want to update, Standard of Care are the one which we need to hang on. This course, Masterclass in Diabetes, who are the target audience? This course can be taken by anyone. So it can be taken by residents, it can be taken by undergraduates, it can be taken by postgraduates, super specialty. Any person who is practicing medicine, they can take this course. So who is learning, who is practicing, they can take. It is not meant for people who practice only medicine or general practice. Any super specialty person, like now diabetes is open for almost all specialties, it has come up. So dermatologists are practicing diabetes, orthopedicians are seeing diabetic patients. So any person who wants to keep them updated on diabetes, on their management, they can take this brief course and they can get themselves updated. There are about 40 hours of lectures which is covered in this masterclass in diabetes. So this course starts with a pathophysiology of type 2 diabetes. Over 2 hours we will be discussing about the pathophysiology. From there we are moving to classification. You need to know about what is LADA, what is monogenic diabetes. Though they are uncommon, as a clinician we need to get updated about these things. Then we will talk about landmark trials in diabetes. Then we move on to, once we have known about the basic introduction, we move on to lengthy lectures, each lecture on drugs, which lasts about an hour. So we'll be talking in detail about metformin, in detail about DPP-4 inhibitors, SGLT2 inhibitors, sulfonylureas. We will be talking about TZDs and also alpha-glucosidase inhibitor. Then we will be talking about insulin. Insulin we have covered exhaustively. So the various insulins which are available in the market. Till today, what are all the insulin, how they all got evolved. So we'll be talking about various insulins, so we need to have a hang on it. The insulin regimens, what are all the regimens that are available in the market, how to uptitrate this insulin, how to start, how to uptitrate, and how to use these insulins in a real-time case-based discussion. Also, we will be talking about some of the practical pointers like how to give insulin, what are all the difficult areas that the patient may have, and also we will be talking about inpatient management of hyperglycemia, which is very, very important. So, in case, like if you want to mimic insulin pump in a real time in your patient, how to go about it? We will not be talking on insulin pump, rather we will be discussing about mimicking insulin pump in practice. So, this is very, very important when you want to see a complicated patient and how it gets managed. Then we will be talking about monitoring. When we come to monitoring, we will be talking about HbA1c. We will be talking about how the continuous glucose monitoring system can be used. Also, we have a talk on self-monitoring of blood glucose. Then we will be discussing about the acute complications. In acute complications, Dr. R.H. Lakshmi will be taking you on hyperglycemic emergencies, how to handle these hyperglycemic emergencies, and also there is 2 sessions on hypoglycemia. One, we will be talking about what is hypoglycemia, and also hypoglycemia in a non-diabetic also we have discussed. Then we move on to chronic complications. When we talk about these chronic complications, there are sessions on diabetes and kidney disease, how diabetes has to be managed in patients of kidney disease. Then we have a session on diabetic foot and diagnosing the high-risk foot. We have a session on fatty liver. Then we will be talking about diabetes and heart failure, diabetic dyslipidemia, diabetic neuropathy, and also Dr. Lakshmi, again, she has given a good talk on infections and diabetes. We have discussed in detail about gestational diabetes also in the 7th module. So how it is being diagnosed, how to monitor gestational diabetes, these are extensively covered. At the same time, the cornerstone of diabetes management is nutrition. So we have dealt in detail about nutrition in diabetes. There are some contemporary topics like what is about reversal of diabetes, what is sarcopenia and diabetes, how can physical activity contribute to blood sugar control. We will be talking about erectile dysfunction in diabetes. So these contemporary topics are also further added. So these are the topics that we have covered in this 40 hours of module. For all those who are hard pressed for time, and finally we have made a session on rapid revision. Like whatever we have covered in this 36-38 hours of modules, we have given it in a nutshell. So you can go and revise over there also. People who want to take exit exams and other examinations, they can very well browse through these modules and they can have a good knowledge of diabetes and they can easily be able to sort out the MCQs with the knowledge that we have provided in this module. Patients who come to the primary care, secondary care or tertiary care always will be having the other associated comorbidities. Of all these comorbidities, the most important thing which is challenging is going to be the management of diabetes. What we have done in this masterclass is across the specialty. It could be any specialty. It could be ophthalmology, it could be dermatology, it could be gynecology, it could be oncology. So any specialty, the patient has to be managed for their diabetes. So this course gives enormous confidence for the provider. It could be tertiary care provider or a primary care provider to manage our own diabetic patients in a more confident way. That is what we have done in this module, so that whatever challenge that they face in the management of diabetes can be handled in a very comfortable way. So this module will, I promise, will give you enormous confidence in addressing all those challenges that you may face in managing of diabetes. Download Raaonline app and subscribe please. Thank you.